So we have several questions that I think should open the discussion, harkening back to Dr. Jakab's palliative care talk. I think, the questions that are coming into the chat really are about how you take the first step. So how do you engage your provider and your family in a conversation about advanced planning? Would you recommend a lawyer? How do you choose your executor or, for example, your, power of attorney? And, do you have to bring a plan to your doctor? Can you make a plan with your doctor? So could you address some of those questions?
Yeah, thank you. These are great questions all into one, but I'll try my best. So first of all, for our patients, they have to keep in mind that the comfort level among their providers, it's very different. So I'm very lucky to have mentors like Dr. Taddei, who introduced me to palliative care, and we work with an excellent palliative care team at West Haven VA. But it's an ongoing learning process. So the same way some patients don't feel like talking about worst case scenario on death, but there are many doctors out there who totally freak out. So, I'm sure you came across these type of doctors or other providers in the hospital when they kind of sort of defer to other they call palliative care council to start the discussion. So there is an ongoing movement to educate all of us to do better in that respect, including more training for physicians during their residency or fellowship. But again, keep in mind that everybody's comfort level is different. But there is no right or wrong how to approach it. Ideally, it should come from your doctor. But if you happen to be more advanced into this, it's as simple as, hey, doc, what do you think the future will bring to me? And is there anything I should, take care of sooner rather than later? If I want, my bucket list, when should I start crossing off things? And unfortunately, none of us has a crystal ball to figure out what the future is going to bring. So that's why it's no better time than the present. Also, keep in mind that as much as these type of discussions ideally would happen in a clinic setting, so there is no stress of, being in the hospital, doctors you've never met, your doctor, your provider has to run a clinic that, seeing patients every 20, 30 minutes. So a bit of advance notice would be much appreciated. It's not the type of doorknob. So it's the visit is over and let's talk about goals of care. Although again, it's okay, bring it up, and it just requires a little bit of planning. In terms of who needs to be at the table to discuss this, of course, the doctors that know you the best and are familiar with the disease course and have a better understanding of what's going to happen in the future, your family, your primary caregivers, who don't necessarily need to be your surrogate decision makers, because sometimes it's very, somebody is so involved, and we are, most of us are very optimistic by nature. I know I usually have my pink glasses on when it comes to this, and everybody's again trying to move things forward. So sometimes you need a more, level person, somebody who maybe is not that involved, to be your person who will make the hard decisions when the time comes. So again, the surrogate decision maker doesn't have to be your primary caregiver. Basically, you choose somebody who you think would be able to speak for you when you cannot do it because of worsening of the disease. Now, in terms of paperwork, as I said, the forms are easily available online. Again, we are lucky with our palliative care team. We have a social worker who usually makes these forms available very easily. It doesn't have to be together with a notary public or an attorney. I mean, so again, this is all about making you feel comfortable. If you prefer to bring an attorney to the discussion, it's okay, it's your choice, but you don't have to do it. the not notary public and the attorney, just to help your witnesses once you make your choices in terms of the surrogate decision maker and the living will. So takes the pressure off the witnesses that, you know, everything is stamped and done and they don't have to get into any legal issues if somebody contests that specifically living will. I'm sure I digressed a lot. I hope I covered most of.
No, you did. Thank you so much. So Dr. Patel, you have a couple logistical questions in the chat box. The first
Go
is,
for it.
do you need to rinse the quinoa?
That's a great question. So I do. You don't. So some people have this like bitter taste that they get from the saponins that are in quinoa, and so I think rinsing it. And again, if you've not had quinoa before, you might not know if you're going to be one of those people. So I do rinse it. I give it a couple of rinses before I make it. But yeah, some people do find it bitter, and so rinsing it can help with that bitter taste. Yeah.
Great. And then will you provide a link to your recipes so perhaps we can
Yes.
attach them? Perfect.
Yeah.
Okay.
Yeah, definitely.
Because a lot of people are making your recipe today and haven't had the facility to jot everything down. So
totally. Yeah.
yeah. All right. And then as far as food is concerned, are there foods that people with liver disease should avoid? So that's one question. And the other question is sort of what are the most protein dense foods that we can think about adding into our diet, even in the person who may be a picky eater?
Yeah. So for number one, I don't ever like to think that there's any specific foods that should be avoided. Now, of course, if you have liver disease, we want to make sure that you're not, consuming alcohol, which can cause further damage to your liver. If you're eating food in general, like well-cooked food, right? You don't want something that's raw or that's potentially going to make you ill. Especially when you're going through treatment and your immune system may not be as strong as possible. And so, if you're eating out, eating at reputable restaurants, making sure if you're eating meat that the meats are cooked properly. If you're cooking meat at home, also not cross-contaminating ingredients, using separate utensils, a separate cutting board for the meat versus the vegetables, and really practicing good just general hygiene at home, hand washing. So I don't like to, like I had mentioned earlier, I don't like to say like you can never have something that you might enjoy. Like I like cake and I have that from time to time, and I find ways to incorporate it into my day-to-day eating that doesn't make it seem so restrictive. That doesn't mean I'm eating a whole piece of cake every day. It's just I find ways that make sense to me. And then the second question about protein dense foods. So, there are a lot of different foods. So I should just go out there and say all plant foods have some amount of protein in them, even like the red bell peppers. But that doesn't mean that I think you should go get all your protein from red bell peppers. It's not dense. And so when we think of protein kind of classically in society, we're always thinking of it kind of, focused on animal derived foods. And so if you're, practicing a dietary pattern that includes both like plant foods and animal foods, really focusing on what I call lean sources of protein. So those are like the less fattier cuts of meat. So, chicken that doesn't have a bunch of fat attached to it, like leaner cuts of animal products, if that's what you're doing. Dairy, of course, has protein in it. Cheese and dairy products, if you consume those. The thing that we want to focus on with animal products is, and the reason I emphasize lean, is that we want to cut down on the saturated fat intake and try to increase the amount of healthy fats that you're consuming. But, like I said, for patients with cancer, it's really important to get enough calories in and really important to get enough protein in. And so, really working with that dietitian to figure out ways for you to do it in a health promoting way is important. That doesn't mean that you only, if you don't eat meat, because I don't eat meat. And so I really love helping people incorporate more plant sources of protein into their day-to-day eating. And so one of the things I was going to bring out, but I didn't end up doing it, is there's tofu and tempeh are probably some of the more accessible sources of plant protein. They're complete proteins. They're both soy products. I love tofu. I use it in place of like lots of different, I use it, I should say, in lots of different recipes. It's almost always like the protein source that I like. Tempeh is a fermented soy product that actually has like a nutty texture to it. And it kind of has a little bit more of a, I don't want to say meatier texture, but it has a little bit more like thicker texture to it. And some people might enjoy that if they're trying to cut back on their meat intake. I like to make tempeh burgers out of it. So I'll marinate the tempeh. And if you just hold on, I'll just bring that tempeh out for just a second so people can see it. I like to marinate the tempeh so it has like kind of these ridges. And so I'll marinate it. I'll throw it into the air fryer. We'll make some burgers out of it, maybe make some skewers out of it. Lentils and beans are really great source of plant protein. They're cheap, especially the dry lentils and beans. You can make them in a pressure cooker. You can batch cook them. You could use canned versions. Just look for the varieties that are lower in sodium or no salt added. I do see those varieties out there as well. And so you want to, you can use those. There's frozen varieties too, but again, look at the sodium and make sure there's no extra sauces or anything. So lentils and beans are great. I like to use some of the higher protein whole grains. So quinoa is one that I really like. Millet is another one. But if you're eating a variety of foods throughout the day, the average person is probably meeting their protein requirements, but they're higher when you're going through treatment or if you're experiencing illness. So working with that dietitian is important, and it's okay to supplement if you need to. Like I make a smoothie and I'll put pea protein powder in there. It's just what I do. It doesn't taste any different, but I know it's more balanced of a smoothie instead of just a fruit-based smoothie, which might not keep me as full longer. So lots of different options to choose from. It depends on your personal preferences and your cultural backgrounds on, what's in your finances too, right? Because food costs are rising. We have to make sure that we, as your healthcare providers, are working with the resources that you have to make those healthy eating habits.
Thank you. That was a great answer. So I think you already mentioned the struggle with salt, right? So we recommend our patients get no more than 2 grams of salt in their diet. It's really hard to have a tasty, savory meal when you're watching your salt intake. So can you tell us a little bit about salt substitutes or spices that give a kick that sort of mimic salt, but aren't, for example, high in potassium?
Yeah, no, great question. So one of the things that I mentioned during the cooking demo was coconut aminos. I will say, just make sure that when you're buying the coconut aminos to look at the sodium intake or the sodium content, because there are some varieties out there that will say like healthier version of soy sauce, but in reality, they actually still contain a lot of sodium. I like to tell people that, salt, when we use it in cooking, especially, it's not meant to be like, we don't really want to taste the salt. We want to taste the flavor. Salt's role is to bring out the flavor. And one of the things that like I used to do when I was like a kind of a more novice cook, I should say, I would kind of just add like the salt in big batches, like at the end. And when you do that, you end up using more. And so what I tell patients or people to do is that when you're cooking, if the recipe calls for like, I don't know, a teaspoon of salt, I would just add it in stages and then taste and adjust and add in stages. Because you might not actually end up needing that whole teaspoon, and just cutting back by 1/8 of a quarter teaspoon in the recipe as you're getting used to lower salt intakes is probably fine. Using lots of fresh herbs. That's why I like to use the green onions. And like I said, I have an obsession with cilantro, but really using those fresh herbs to bring those flavors out. And I like using lemon juice, especially when I think a dish needs more salt, or if I need to balance a dish a little bit more. Instead of just adding more salt to it, I'll add lemon juice or some lime juice. I think it really just helps bring the flavors out. And that way you're like, okay, this is more of a balanced tasting dish. And this takes time, if you're not used to cooking, like it's hard, you really kind of may cling to that recipe, and that's okay. That's where we're all learning from. But like I said, helping people find the blueprint that they can use to help make their meals versus relying on the recipe is like really what the end goal is, but that takes time. I don't really, there are salt substitutes out there. Of course, there's the potassium salt substitutes, there's potassium containing salt substitutes, and you have pretty, advanced kidney disease, or if you're on medications like spironolactone, like you really want to make sure that you're talking to your healthcare providers and your dietitian about whether you're including some of those salt substitutes so that your, potassium level can be monitored. I don't typically turn to those. I talk to my patients about adding flavor, balancing out the flavor with lemon juice, really adding salt in that stepwise fashion so that you don't end up needing to add more at the very end. I think that's really important, especially like, okay, if you have a recipe and you're like sauteing onions, you know, I really do add a little bit of salt there to get the onions more translucent, bring out the juices. Then if I add tomatoes, I'll add a little bit there. Again, just to let it all cook down, and just add it in small stages and measure out your salt. I will say that oils and salts, just measure them out. Especially if for some reason you need to watch those for, you know, for our patients, especially with the salt intake, don't, what should I say? Try not to just take the handful and put it into whatever you're cooking. So yeah, that's kind of how I view the salt.
Yeah, that's very helpful. I think we have about a minute left, and I just wanted to ask Dr. Jakab, what happens if you don't want to tell your family that you have liver disease or liver cancer and you want to engage in these conversations? How would you counsel that type of person who's reluctant to involve their family?
That's a very difficult situation because we've all seen how much help having family around and support, especially when facing such a severe illness and complex treatment decisions. So having somebody, at least as a sounding board, it's really important, just somebody to vent to. But ultimately, our duty as providers is to follow our patients' wishes, as much as we may not agree with them. Ultimately, we have to respect that wish, but I usually don't give up and I keep trying to bugging the patients, you know, friends are good.
Yeah, I agree. I think that's the most important thing, you know, to have somebody who can be another set of eyes and ears in the doctor's office really helps. So even if it's not family, it could be a friend. So I agree.